Hi guys, hope you all are fine and doing well. Today I'm going to share with you medkit essentials for medical students, doctors, or the people who are doing their internship or house job, which stuffs they need to keep in their medical kit. Which will be useful during their duty or their classes. So I had this big pouch or this big bag in which I kept all of my stuffs, and now I'm going to open it and show you all the things. Now the first thing is the stethoscope. I don't keep this stethoscope in this pouch because it's mostly in hand, because it has to be used very frequently, but just for showing you I just kept it inside it. So the first most important thing is the stethoscope, and then is this clinical hammer which we use for neurological examination. It is very also important in your medicine classes for the students, and also during your internship for the examination of patients. And then here are the tuning forks. These are used in ENT, and ENT is mostly being taught in the 4th year of medical school, and you can also use it if you are doing internship in ENT. And then here is this BP apparatus. This is also very important because in the house job or the internship you have to do the vitals of the patients. For that you need the stethoscope, the BP apparatus. And then I have this another small pouch in which I have kept other small things, like here is this pulse oximeter. It is also used for doing the vitals of the patients, so it's better to have one. And then the glucometer. It is also an essential part of the vitals because you have to do vital monitoring and RBS monitoring of the patients every now and then. And these two containers, I think these have these strips and lancets for the glucometer. And then I have this pocket, this mini stamp which we use for the documentation, because documentation is very very important during your internship or house job. And then this stapler, and other things are the stationary items, but this inch tape or measuring tape, it is using for the respiratory system examination, and also in the obstetrics and gynecology for measuring the fundal height, etc. There it is the most important thing. And then thermometer for recording the temperature of the patients. This is a digital one. And then I have this torch. It is also very important for checking inside the mouth, the nose, and other orifices. You need a source of light, so you must have a pocket torch with you. And after this I have this tongue depressor. It is just kept inside this paper cover. It is a tongue depressor. And then a wisp of cotton. These things are also used during the neurological examinations. And then this mini scissors. It is also sometimes you need to just cut something or some, like all the emergencies. And then this small box of toothpicks, and it is also like useful during the for assessing the neurological status of the patient, and many other things. So I have kept it here. And then I have this marker. I kept it for the purpose of just writing on the patient's files or names in the bold letters, that's why. And then this correction pen, because during documentation sometimes you make some mistakes or minor errors, so for the correction of those. And then some pens, just keep some pens with you. And then these stickings, Mostly we use these stickings in the hospital, but sometimes this one doesn't work when you are fixing an NG tube on a patient. So for that you need these special stickings. So for I have kept these extra with me. And then this we use as a tourniquet. It is not a real tourniquet, that is something else, but we just use it just to improvise. And then I have this packet of gloves. I have kept it just for the emergency situation. Sometimes surgical gloves are not available in the ward, so for that moment. And then this is the wheel on which we can calculate the gestational age, the expected delivery time. It is used in the gynae. It was given by some MR, so I just put it in my kit. So guys, these are all the stuffs which I have in my med kit. Now there are some things which you don't need as a medical student. Those things are required only when you are working as a doctor or during your internship. These are the things I have just segregated, these which you need if you are still a student, a medical student during your third year, fourth year, final year years. So you need only these things: stethoscope, BP apparatus, hammer, tuning forks, torch, thermometer, tongue depressor, inches tape. That's it. And then, but when you are in the house job years, you need to keep the other things like the glucometer, the pulse ox, and those other things like the scissors, markers, stapler, stamp with you. So guys, I hope you find this video helpful. Thank you for watching. Take care and goodbye.